I start by introducing myself and making sure that she's okay that I work with her. Then I ask her for consent and then guide her arm all the way into 180 degrees of flexion. Then I go into active range of motion and have the patient perform the action for me. Then I test her strength by putting her arm into 90 degrees of flexion and then applying downward pressure at the wrist, telling her to resist the pressure, and she scored a 5 according to the numerical muscle grading scale. Next, I'm going to test her movement using the goniometer. She's going to lie supine with her knees bent and feet flat and then her forearm in neutral position. I'm going to guide her arm all the way into flexion and then have her do it herself. And then using the goniometer, I'm going to find her aspect of the graded tubercle, and that's where the fulcrum is going to go. So I use my hand to palpate that, find the greater tubercle. The stationary is going to be parallel to the mid-axillary line of the thorax, and then the movable is going to be lateral midline of the humerus. You're going to follow that all the way down, and then she measured at 180. Next, I'm going to measure her muscle length of her pectoralis major sternal fibers using a tape measure in centimeters. Lying supine, I have her abduct her shoulder into 135 degrees and then her shoulder externally rotated. Measure her lateral epicondyle to the table. I perform a manual muscle test on her anterior deltoid. I have her seated, her elbow flexed 90 degrees, shoulder in position of 90 degrees, abduction with slight flexion and slight external rotation. Then I apply pressure against the distal humerus and down. Do a manual muscle test on the middle deltoid with the elbow flexed and abducted at 90 degrees and apply pressure at the distal humerus. Next, I test her middle trapezius. The patient is lying prone, her shoulders 90 degrees of abduction and externally rotated. Once she is in this position, I apply pressure at her wrist using my other hand for support, and she scored a 5. I perform the special test. I am performing the empty can special test, which tests the supraspinatus. I have her seated with her upper extremity elevated to 30 to 45 degrees in plane of the scapula and internal rotated. My fingers on her wrist and have her resist my downward pressure and then look for any signs of pain or weakness.